FDA chief's resignation widens a leadership gap at the nation's health department. Add AP News as your preferred source to see more of our stories on Google. Add AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share Washington app. When the week began, several senior positions at the U.S. Department of Health and Human Services were already sitting empty. There was no Senate-confirmed U.S. Surgeon General. The head of the National Institutes of Health was doubling as the acting head of the U.S. Centers for Disease Control and Prevention. The Food and Drug Administration lacked a permanent vaccine chief after that official was ousted for a second time in a year. Then on Tuesday, Dr. Marty Makary resigned as head of the FDA, leaving another major health agency with only an acting commissioner. Makary's departure widens a leadership gap that has plagued HHS throughout Health Secretary Robert F. Kennedy Jr.'s tenure. Across a vast and multilayered government, in which many leadership positions must be confirmed by a Senate that shares only a narrow partisan majority with the administration, it's typical for some roles to remain unfilled or be occupied by interim leaders. But critics say the level of upheaval in the current HHS is unusual, and the lack of scientific expertise among its leadership is concerning. It's a sign that something is not right in this department, said Dr. Daniel Jernigan, a former senior employee at the CAC. Critics say the problem has only been compounded by a raft of cuts and firings and by the broader disruption brought by Kennedy's health policies. Read more. HHS didn't immediately respond to a request for comment Wednesday. Kathleen Hull-Jamieson, director of the Annenberg Public Policy Center at the University of Pennsylvania, said most Americans don't pay attention to these agencies' leaders until a public health concern arises, like with the hantavirus outbreak. At moments like this, she said, there are opportunities to build public trust in federal health agencies, which has fallen in recent years. The key question for me is, when we need these agencies to speak, will they have the capacity to draw the science together and tell us what we need to know? Jamieson said. FDA's leadership void happens as it faces ongoing challenges at the FDA. Makary leaves behind unfinished initiatives and ongoing reviews under scrutiny, including work on ultra-processed foods, food dyes, antidepressants, and COVID-19 shots. Whoever steps into the role on a permanent basis will inherit the same challenge that David Makary's tenure, balancing the anti-regulatory interests of traditional Republicans with the anti-corporate priorities of Kennedy, who is focused on scrutinizing ingredients in food, medicines, and vaccines. The FDA is developing a first-of-its-kind definition of ultra-processed foods, which Kennedy blames for elevated rates of diabetes, obesity, and other chronic conditions among Americans. That task has fallen to the FDA's Deputy Commissioner for Foods, Kyle Diamanters, who recently described the effort on ultra-processed foods as really hard at a health conference. Diamanters was tapped by Trump to lead the FDA on an acting basis. He is also serving as a chief counselor to Kennedy, an attorney and friend of Donald Trump Jr. He is the first person in more than a half-century to head the FDA without a degree in medicine or science. Kyle Diamanters now has a nearly impossible charge, said Dr. Peter Lurie, a former FDA official now at the Center for Science in the Public Interest, leading as a non-scientist, a science-based agency under an unqualified secretary who puts his own medical and nutritional pet peeves over evidence-based public health. CDC has cycled through a revolving door of short-term directors. The Trump administration's first pick to run the CDC was former Florida Rep. Dr. David Weldon, but his March 2025 Senate confirmation hearing was canceled an hour before it was to begin. Weldon said at the time that he'd been told not enough senators were willing to vote for him. The White House then moved on to Susan Monterez, who was confirmed by the Senate, but she was ousted in less than a month over disagreements on the administration's agenda. Several key CDC scientific leaders resigned in protest, saying Monterez's dismissal dashed their hopes that a CDC director would be able to guard against political meddling in the agency's scientific research and health recommendations. Since then, multiple HHS officials have been acting director. National Institutes of Health Director Jay Bhattacharya has been overseeing the CDC since February. Last month, Trump nominated Dr. Erica Schwartz, a former deputy surgeon general, to be the next CDC director, a choice the Senate must confirm. Current and former CDC employees say that there's been a void in experienced public health leadership at the agency and that Kennedy's aides have slowed and sometimes choked off its ability to communicate with the public and do the full scope of science-based work it was doing in the past. HHS officials have said that the CDC's critical public health functions have remained intact and effective, and that changes at the agency have been part of an effort to restore credibility through transparency, gold standard science, and accountability. Jernigan, who last August resigned from a senior role at the CDC that has yet to be filled by a permanent replacement, said the leadership shuffle means there hasn't been a strong present CDC director in place to campaign for important agency funding.